Welcome to the Children's Mental Health Lab. The title of today's program is Attention Deficit and Hyperactivity Disorder, or ADHD. ADHD is an abbreviation for Attention Deficit and Hyperactivity Disorder and is one of the leading developmental disorders in children's mental health. Looking back on when we were little, there were surely some of our friends who were restless and energetic.
Yay!
Perhaps you were one of them. These seemingly childlike characteristics, such as restlessness, inability to continue concentrating, and inability to wait for one's turn, can also be the manifestation of inattention, hyperactivity, and impulsivity that are typical of ADHD. Today, let's discuss ADHD, which reportedly affects approximately 5% of children under the age of 18 worldwide. ADHD is a developmental disorder that mainly presents as inattention, hyperactivity, and impulsivity. Let's look at each typical symptom. Inattention. This is having trouble concentrating and forgetting or losing things very often.
What? Something is missing.
Hyperactivity and impulsivity. Clearly separating these two symptoms may be difficult. They are characterized by restlessness, inability to sit still, and inability to wait for their turn.
Please get out of the way. I'm first.
As discussed earlier, since these features can also be considered typical for children, care must be taken that not everything is considered ADHD. Looking at the diagnostic criteria for ADHD, we can see that it is characterized only by inattention, hyperactive and impulsive behavior. For this reason, the hope is that a decision is made based on careful examinations of ADHD symptoms of inattention, hyperactivity, and impulsivity, bearing in mind that children often show different facades depending on the place and person. Here is one thing to note. Many parents and guardians with children diagnosed with ADHD have misconceptions and experience worries. This misconception is that the onset of ADHD is due to the inappropriate raising of children. This is totally incorrect. In current mental health care, some research studies suggest that ADHD may be a dysfunction of the frontal lobes and cerebellum. This has no correlation to the inappropriate raising of children. It can be viewed as being caused by biological factors. However, for children who are abused, the effects of an inappropriate environment or even depression in the child may cause noticeable irritability. Thus, children may appear to have ADHD symptoms for many reasons, and caution should be taken with the diagnosis. Now, let's talk a little about how to handle children diagnosed with ADHD. In their daily activities, children with ADHD often fail suddenly because of their impulsivity, and they may feel remorseful afterwards. However, this impulsivity can again lead to failure, causing a vicious circle.
Why not?
Oh no, I'm sorry.
We often end up saying things like, "Why can't you do that?" or "Why can't you stay still?" to children with ADHD experiencing trouble and making mistakes. Sometimes this can become sarcasm. This results in the child tending to have low self-esteem along with negative feelings, such as thinking "I get scolded all the time," or "whatever I do ends up bad anyway." As children with ADHD grow up to be adults, they need to face and accept their forgetfulness and impulsiveness. If their self-esteem is very low at that point, it can be difficult to accept and confront their own traits. Parents, attending physicians, counselors, and sometimes teachers should value the self-esteem of children with ADHD.
That's awesome.
Oh, I was given a pat on the back.
Since many children with ADHD symptoms are always smiling and genial, it may be difficult to gain a sense of their self-esteem. We should pay a great deal of attention to children's strengths such as what they are good at, hobbies, and kindness other than ADHD symptoms, and we should always approach them with praise. By gaining a sense of understanding and acceptance, children with ADHD are able to thrive. That concludes this video. Did you gain a better understanding of ADHD, one of the leading developmental disorders? Although a little technical, psychosocial therapies such as parent training and pharmacotherapies for the treatment of ADHD will be discussed further in other videos, so please look forward to it. We have included a variety of access links to information in the overview section, and we hope you take the time to read these and that these may be useful to you. Thank you for watching the entire video. We hope to see you again in the next video. See you later! We also hope you will subscribe to this channel.